Dr. Marc Fishman is an addiction psychiatrist and consultant with Maryland Addiction Consultation Service, or MACS. MACS provides support to prescribers and their practices, pharmacists, and healthcare teams in addressing the needs of patients with substance use disorder and chronic pain management throughout the state of Maryland. Dr. Fishman is an addiction psychiatrist. He's the medical director of Maryland Treatment Centers and a member of the psychiatric faculty of the Johns Hopkins University School of Medicine. His clinical specialties include treatment of drug-involved and dual diagnosis youth, opioid use in adolescents and adults, and substance use with co-occurring psychiatric disorders. His research work has focused on medication treatment for substance use disorder, as well as models of care and treatment outcomes in youth, in particularly opioid disorder. He has been a president of the Maryland Society of Addiction Medicine and is currently a member of its board.
Thanks for having me.
Katie is a person in recovery from both substance use and mental health. She will have 10 years sober in November of this year. Katie is part of our staff at the health department here in Calvert County. She's one of our adult coordinators for services here with our local behavioral health authority.
Thank you, Anita. I appreciate it.
So the first question I have is substance use disorder or mental illness considered a disease? And if it is a disease, what constitutes it to being a disease?
What a great question. These are potentially devastating disorders, whether they are addictive disorders, the whole spectrum of substance use problems, opiates, others, whether it is mental illness, depression, anxiety, PTSD, ADHD, schizophrenia. All of these are potentially devastating disorders that cause people such distress and have potentially, as you may know, fatal outcomes. And it's so important to stress the idea that we live in an age where we're so fortunate. We have the ability to approach some of these disorders with medical technology.
It's very evident in my family that depression and anxiety run rampant on my mother's side. And I think it's one of those things where it was a really hard thing for me to come to acceptance that there was something chemically different in my brain as opposed to even some of my siblings that I needed to treat. And the same goes for substance use. We have like a great uncle that died of alcoholism, but no one in my direct family ever had an issue with substances. So it was very difficult for me to come to that acceptance piece as to what's wrong with me. I'm one of 5 children, and why am I the only one that has severe mental illness as well as substance use issues? It wasn't until I started the program of recovery and I learned what addiction was, that it wasn't my fault, that I not only was genetically predisposed to these issues, but ultimately there was a lot of different opportunities for me to utilize these issues to treat them and then to use them for my benefit.
There's always been this thinking that there's some sort of stigma attached to persons in recovery, that if you are taking medication, that does not speak to that you're actively in recovery. Katie, have you experienced that?
It is something that I've had to learn in my recovery. When I was in treatment and I had to determine what my recovery date was, my sober date, I remember people that I was in treatment with said, you have to wait until after you were off Suboxone before you can make that your clean date. And I remember being like, no, the day that I walked into treatment after the last day that I used the substance to get high is my clean date.
Dr. Fishman, if you being on medication, does that impact whether or not you're actively in recovery?
This false myth that being on medications is not real recovery is so wrong, and unfortunately puts off so many people from seeking care through stigma and through misunderstanding, whether it's misunderstanding oneself or of one's family and loved ones. What do you mean it's not real recovery? Is it not real recovery that you prevent heart attacks and strokes by taking antihypertensives? We need to appreciate people's view, and one particular place where this comes from is that some of the medicines that we use, say for opioid use disorder, are chemically related to opioids. But as you pointed out, if you're not getting high, if in fact what you're doing is stopping your use of illicit substances, if you're under the care of a physician who monitors you with the appropriate use of the medication, if your life is getting better, not worse, then that's the definition of good treatment response. But in that multi-component array of possible tools, are these medicines? And again, to denigrate them by saying they are less than or not real recovery is a real disservice to people in trouble who need them.
When people say it doesn't work for me, whether I took medication for some issues or whether I took medication for my mental health, and they say it doesn't work, what would be some of your strategies for that, Dr. Fishman?
It's an unrealistic expectation to say that we've got a silver bullet, a magic cure, one size fits all, that there's one solution that's going to work for every person. That's not true in any treatment. There's not one thing that works for everybody. It might not work because your particular biology or genetics is not the right match with medicine A. Well, thank goodness we got medicine B. It might be that medicine A gave you some side effects. Yeah, that happens. All of our medicines have potential side effects, even Tylenol. That doesn't mean we say, I'm never going to see a doctor or a caretaker again. It means that we've got to have relationship building over the long haul with caring providers who can tolerate fits and starts. If it's 3 steps forward and 2 steps back, that's okay. If it's try something and this particular thing didn't work out, try again. And I gotta tell you, my personal approach to this is one of what I call therapeutic optimism. Never give up. There's always something else to try. And again, it's a miracle of the modern age that we have these tools. So you just keep trying something new and trying something new. Now, having said that, I can appreciate how frustrating that might be to patients. And so you're right to point out that people say nothing worked or it didn't work. And I apologize. I wish I had something better, more magic, that it would fix everybody. But we try our best. And what I would say to people is don't give up. Keep trying.
I've been on a medication for majority of my adult life, and with COVID and with the few years that we've had, it wasn't enough, and I really needed, it was time to switch, and it was time to change, and I tried something, and unfortunately it didn't work, and so I'm trying something different. And again, I won't give up because I know what it's like to be stable on a psychotropic medication, and I want that life.
So Dr. Fishman, do you think that medication is a short-term or a long-term solution?
Yes, it depends on the circumstances, but in the conditions that for the most part we're discussing today, opioid use disorder, alcohol use disorder, major depressive disorder, for most people it takes weeks to months to stabilize, and then months to years to consolidate and maintain. And one of the things that I like to explain to people, if they can digest it, is listen, you didn't get to this point of misery in your life overnight, and it's going to take a while for you to get back on your feet. So let's not have a big fight today about, do I have to stay on this for the rest of my life? How am I going to get off of this? We'll get there. For now, let's get you on it. Let's get your life better. You tell me what the appropriate goals are for your personal recovery. You tell me what the things you want to achieve as your depression is better, as your addiction is better. And when you've achieved those, then we come up collaboratively with a strategy to think about what the long term is. But the information that we have scientifically is that longer duration of treatment for most people, there's no one answer for everybody, but for most people is better.
And again, it comes down to, Dr. Fishman had said, risk and benefit. Yes, being on Suboxone to assist me in coming off of hard drugs is scary, and you face the stigma associated with it, but is it going to save my life? And will it allow me to live a normal life? And the same goes for psychotropic meds, where there are side effects that are scary, and there are the potentials to withdrawal. I've been experiencing withdrawal all week. It's not fun. But I know that ultimately the benefit of finding something that works for me with the least amount of side effects that I can tolerate and live with is worth it. And I think that that's a huge fear of people. And again, in the recovery community, I hear it all the time. People withdrawing off Suboxone, so then they go back to the drug of their choice. And that's just not it. If you're taking it as prescribed and you come off of it as prescribed, it's going to be a lot easier. And the same goes with mental health medications. Is I've quit cold turkey and then wondered why I have suicidal thoughts 2 days later, as opposed to coming off of it as directed by my physician I'm experiencing withdrawal, but it's tolerable. And so I think for someone in recovery, it's really important to weigh out the risks versus the benefits, where Dr. Fishman said, I would much rather have little bitty side effects and potential stigma and live a happy, normal life than to go on with struggling to stay sober and or struggling to stay sane, in lack of a better way to say it.
I'm so optimistic about our ability to help people with behavioral health conditions. We're in a golden era. We'll get better, and in the next lifetime, figure out new technology. But dang, it's pretty incredible what we figured out. Don't turn up your nose at available tools. Try stuff, you can get well. You don't have to suffer endlessly.
If you are struggling or have a loved one who may be struggling with behavioral health issues, please call our Recovery Rapid Response hotline number at 1-877-467-5628. That's 1-877-467-5628.